My topic is the death of genetic testing patent. In the introduction we have the Ariosa diagnostic. Sikinon was a controversial decision of the Federal Circuit. One patent said that a very practical problem can be solved with fetal DNA access without creating a greater risk for fetal health. Sikinon is an exclusive license of United States patent, which claimed methods of using pseudo-free fetal DNA circulating in paternal plasma in order to diagnose certain fetal genetic conditions such as Down, which can be detected by observing the presence of additional chromosomes without the use of invasive tests.
So for instance, the one we use at Hopkins has 1 million probes, starting from the top of chromosome 1 and ending at the bottom of the Y chromosome if you have one, or the bottom of the X if you don't have one. And so you can imagine we can see much smaller missing, or we can't see them, we can detect much smaller or missing or extra pieces. And so we have many more disorders that we recognize because of what are called chromosome microdeletions or chromosome microduplications. Okay. And initially when we started doing this test, we got all kinds of results that we had absolutely no idea what they meant. Is this real? Is it important? Is it not important? Once we've probably done 20,000, 25,000 people, maybe even more, have been done by this method, both normal and people with problems. And once you have enough people, you can start statistically sorting out, we see this in so many normal people, this is normal. This is not a disease-causing variation. Or we only see this in people with problems. This must be causative. Two people without disease, can have as much as 12 million base pair variation in their DNA because of extra and missing pieces. So that's normal variation, 12 million base pairs, a whole lot. Whole exome sequencing looks at the coding portion of the genome. And the coding portion of the genome is about 1.5% of the genome. And it's the part that codes for protein. So if we have 22,500 genes, it's looking at those, just the part of the genome that codes for actual protein. And when you do whole genome sequencing, you are looking at the whole genome, all 6 billion base pairs, from number 1 to number 6 billion. Before we do that test, we tell people we're going to have 4 possible outcomes. One is we find a chromosomal variation that explains the problem in this patient. That's ideal. That's what we hope for. The other is we find totally normal result. Okay, well, this test didn't help us. We still have to keep going. The third possibility is that we find something that we don't understand. So we may have to do parental testing. We may have to wait for more data to come down the pike over some number of years. It'll be a variant of unknown significance. And the fourth possibility is that we uncover something we weren't expected to detect, like a cancer risk, like another later onset disease that we didn't look for at all, but we find by this method. So that's everyday current clinical practice. This is what we do for a living. We send this test.
In the application of medicine, 3 million of tests have been performed, and CFF-DNA prenatal screening is on a track to become a first-child prenatal screen for all pregnant women, not just high-risk pregnancy.
Well before they're born, parents-to-be worry and wonder if their child will be healthy. That's why prenatal appointments like this one at the end of my first trimester are so important.
Heart rate's about 157. That's great.
As word of mouth spreads, more patients at the Perinatal Center of Oklahoma are requesting the cell-free DNA test. Done as early as 9 or 10 weeks, it looks at small amounts of actual fetal DNA in mom's blood.
It's a non-invasive screening test that can detect certain genetic disorders in certain high-risk populations.
The 4 companies aggressively fighting for their slice in the game: Panorama, Maternity 21, Harmony, and Verify, all of them boasting the ability to detect certain genetic disorders like Down syndrome with extremely high accuracy. And the added bonus of some tests: You find out the baby's gender early.
The new test offers the advantage in this high-risk group of having the highest detection rate with the lowest false positive, and that's what people are excited about. Just the skull, soft spot.
Dr. Charles Morabli says right now the tests are just recommended to high-risk patients, women 35 and older, or when other tests or ultrasounds show cause for concern.
This is looking on the baby's brain.
But with more studies underway, the tests could become standard for all pregnant women as early as next year.
It very well may happen.
And that raises some issues. Dr. Morabli warns the tests carry a higher false positive rate in pregnancies that aren't high risk. And some doctors might not know how to properly interpret the results, leaving patients with more questions and uncertainty. Some argue the tests will encourage more abortions of babies with Down syndrome.
It's still very important that people undergo genetic counseling, preferably pre-test genetic counseling, where they can understand what all the different testing alternatives are, what the test means.
The new tests don't replace amniocentesis or CVS, which carry a risk of miscarriage, but they do offer new options to parents-to-be and the chance to learn earlier than ever before about their baby's health.
So they have the opportunity to make decisions about their pregnancy, but also to be prepared.
In the pros and cons.
The best-selling pregnancy book is called What to Expect When You're Expecting. During this exciting time, you have more important questions than ever before. Am I having a boy? A girl? When will my baby be here? And most importantly, will everything be okay? The Maternity 21 Plus laboratory-developed test from Sequinome Laboratories provides insight on questions you have surrounding your pregnancy. There are many ways to get information and answers about your pregnancy and your baby, such as a diagnostic procedure like amniocentesis, procedures such as ultrasound, or a non-invasive prenatal blood test, or NIPT, such as Maternity 21 Plus. While amniocentesis is invasive and involves a needle to remove fluid from around the baby, Maternity 21 Plus is a screening test that involves a blood draw on mom only. An ultrasound can tell you if you're having a boy or a girl, but it's usually not until about 20 weeks into your pregnancy. With the Maternity 21 Plus test, you can find out as early as 10 weeks into your pregnancy. The Maternity 21 Plus test analyzes placental DNA fragments circulating in your bloodstream. It can tell you if you're having a boy or a girl, and screen for chromosomal abnormalities such as trisomy 21, which is associated with Down syndrome. So what makes the Maternity 21 Plus test different from other NIPTs? While other tests may report results as high risk or low risk, the Maternity 21 Plus test will definitively let you know if you screened positive or negative for common chromosomal abnormalities. The Maternity 21 Plus test also returns more information than most NIPTs, so you know what to expect. And Maternity 21 Plus is backed by Sequinome's Every Mom Pledge. We accept all patients and all insurance because we believe every patient should have access to the best possible care. That's why we work directly with you to make sure Sequinome Laboratories testing services are both accessible and affordable no matter what. For more information on the Maternity 21 Plus test, visit our website or call 877.
In the advantage, we have a pregnant woman obtains information about possible chromosomal abnormalities in the fetus. Knowing this information in advance can help expectant parents plan and prepare themselves as well as their home for a baby who may have special needs. In the disadvantage, we have in the screening yields positive results, then a woman and her partner will have to deal with this new information and choose whether or not to act on it. Parents may follow up by seeking out genetic counseling and undergoing prenatal diagnosis tests to more accurately detect whether the fetus actually has a genetic condition. A positive diagnostic testing result will cause them anxiety if they choose to continue the pregnancy, or if the genetic finding may provide reassurance if they decide to terminate the pregnancy as a result of diagnosis. In the age of light in Ecuador, we have the video.
There are many prenatal genetic testing options available today that can provide information about genetic conditions or birth defects in the baby. Which tests or whether to undergo any of these tests in pregnancy is your choice. One of the most important questions to consider when deciding about prenatal testing is, what will this information mean for you? Knowing the answer to this question can help you make the choices that are right for you. Prenatal genetic tests can be put into two categories. 1. Diagnostic tests, such as amniocentesis and chorionic villus sampling, CVS, can provide definitive yes or no results. However, these tests involve some risk, including a chance of miscarriage. 2. Screening tests include blood draws, such as maternal serum screening, prenatal cfDNA screening, and ultrasound. In general, screening tests pose no risk to the baby. However, they only tell you if the chance of a genetic condition or birth defect is higher or lower, and do not give you yes or no answers. Prenatal genetic testing is your choice. Some women would prefer yes or no answers, and since screening tests, such as maternal serum screening and cell-free DNA screening, cannot provide that, they may choose to go straight to a more definitive test, such as CVS or amniocentesis. Or they may consider a diagnostic test after having a screening test that suggests a higher chance of a genetic condition in their baby. Questions to consider regarding diagnostic testing include, if your baby had a genetic condition, would you want to know before birth? For example, some women would want to know if their baby had a genetic condition or birth defect because they would want to be able to prepare before delivery. Some women would consider making an adoption plan for their baby, and some would consider ending the pregnancy if they knew their baby had a genetic condition. Do you feel like yes or no answers would help you feel less worried? Are you comfortable with the risk of miscarriage associated with these procedures? Questions to consider regarding screening tests, such as maternal serum screening or cfDNA screening, include, how would you feel if results indicated a higher chance for a genetic condition or birth defect? Would you consider a diagnostic test if a screening test indicated an increased chance for a genetic condition? If not, would you be okay waiting until the baby is born to know for sure if the condition is present? Do you think this information would help you feel more prepared? Does more information with the possibility of uncertainty make you anxious? Some women feel that prenatal genetic testing is not right for them. Consider these questions. Would you prefer not to face the decision of whether or not to have a diagnostic test if your screening test came back with a result showing your baby has a higher chance of having a genetic condition? Are you confident that, even if the baby did have a genetic condition, it wouldn't change your pregnancy plans? There are many prenatal tests available, and your healthcare professional will be able to determine, based on a number of factors, which prenatal testing options are the most appropriate to offer you. The decision to undergo prenatal genetic testing is personal and should reflect your values, personality, beliefs, and needs. Your decision may be very different than the path your friend or neighbor might take, and that's okay. In most cases, prenatal genetic testing is a choice, and the best way to make the decisions that are right for you is to be informed.
In Ecuador, the study of genetic makeup of the Ecuadorian population encouraged planning of genetic health intervention and maybe one day the institution of personalized medicine. Another important challenge is the change of our laws to allow the prevention of genetic disease, prenatal and pre-implantation diagnosis, and cell-free DNA in maternal serum. In the absence of therapeutics, abortions for fetal conditions, preventative actions are not concrete. Many of the demands for attention of patients with genetic conditions, including genetic and reproductive counseling, will be solved by the National Genetic Center, which remains to be established. In the conclusion, we have the placental cells could be detected in maternal blood during pregnancy, revealing information about the fetal genome or genotypes. It detects anomalies in the fetus. It avoids invasive procedures such as amniocentesis and chorionic villus, sampling that carry a small but significant risk of pregnancy loss. The patent applies to any method that involves amplification detection of paternal-derived cfDNA from a pregnant woman's blood. Thank you.
This video, produced by the charitable nonprofit organization Genetic Support Foundation, provides important information about non-invasive prenatal testing, NIPT, including how it works, what results actually tell you, and how to decide if this test is right for you. What is non-invasive prenatal testing? Non-invasive prenatal testing, or NIPT, is an optional blood test that can be performed beginning at around 10 weeks of pregnancy and can screen for certain genetic conditions. NIPT goes by many different names, including non-invasive prenatal screening, NIPS, and cell-free DNA, cfDNA, testing. You may have heard it referred to as the new gender test, or be familiar with specific test brand names. How does NIPT work? Our blood contains fragments of our DNA, known as cell-free DNA. When a woman is pregnant, her blood will also contain DNA fragments from the placenta, which has a genetic makeup that is usually identical to that of the developing baby. By analyzing this DNA in mom's blood, it can be determined if there is an increased or decreased chance for certain genetic conditions. What conditions does NIPT screen for? Though this testing began as a screening for Down syndrome, over time the list of conditions being screened has grown, and the effects of the screened conditions vary tremendously, from very mild to severe. In some cases, NIPT can also predict the gender of the baby. Most of the conditions screened for do not run in families. The chance that a pregnancy is affected with a condition depends on a number of factors. Another note, not all NIPT labs screen for the same conditions. What can NIPT tell me about my pregnancy? NIPT is a screening test that can determine if the chance of certain genetic conditions in a pregnancy is higher or lower. Since NIPT is a screening test and not a diagnostic test, it cannot give you yes or no answers. If results indicate a high or increased risk, then a diagnostic test, such as amniocentesis, can then be performed if the patient desires to determine whether the baby really has the condition or not. If the results indicate a low or decreased risk, the chance the baby has the condition is lower but not zero. Keep in mind that false positives and false negatives do occur with NIPT. The chance of a false positive or false negative result depends on the condition and also which NIPT lab is used. NIPT requires only a blood draw, so often it is described as not having any risk, but it may be helpful to think about what the test results may mean for you. Most of the time, the test will come back low risk, and many women feel relief based on these results. However, if the test indicates an increased risk, it may create worry and uncertainty about what to do next. Follow-up testing, such as amniocentesis, that can tell for certain whether or not a genetic condition is present in the baby, does present some risk to the pregnancy, including an increased risk of miscarriage. The risk of miscarriage from amniocentesis is less than 1%. Here are a few questions to consider to help you decide if NIPT is right for you. How would you feel if results indicated a higher risk for a genetic condition?
Would you consider amniocentesis? If not, would you be okay waiting until the baby is born to know for sure if the condition is present? Do you think this information would help you feel more prepared? For example, would you consider doing anything differently if you knew the baby had a genetic condition? Does more information with the possibility of uncertainty make you anxious? Some women would prefer definitive answers, and since NIPT cannot provide that, they may choose to go straight to a more definitive test, such as amniocentesis. On the other hand, some women may feel comfortable with their chance of a genetic condition, or are confident that, even if the baby did have a genetic condition, it wouldn't alter their pregnancy plans. Or they may prefer not to face the decision of whether or not to have an amniocentesis if the NIPT comes back high risk. In these cases, some women may decide not to undergo any prenatal screening. So how do you decide about NIPT? The decision to undergo any prenatal genetic test is personal and should reflect your values, personality, beliefs, and needs. This decision should be made in consultation with a healthcare professional. There are many prenatal tests available, and your healthcare professional will be able to determine, based on a number of factors, if NIPT is an appropriate test to offer you. Your decision may be very different than the path your friend or neighbor might take, and that's okay. In most cases, prenatal genetic testing is a choice, and the best way to make a decision about NIPT that is right for you is to be informed. We hope that this brief overview of NIPT.
Thank you.